push, very long one.
Though maternal health care has improved over the past 20 years, the pace has been slow and extra effort is required for Ghana to achieve the Sustainable Development Goal 3 in reducing maternal mortality.
When you look at the statistics of maternal health in sub-Saharan Africa, Ghana is one of the countries not doing too well. We've made a lot of improvements in our democracy and our good governance. We have a lot of improvements in most of our educational sectors and other sectors. But then when you look at the health sector and when we consider maternal health, it's untenable and it's sad to know that we still lose women just because they got pregnant or just because they wanted to give birth to life. And for us, this is unacceptable in the 21st century.
In urban Ghana, 82% of women deliver in health facilities. This, however, is not the case in rural Ghana, as only 42% deliver in approved health facilities.
When you look at the antenatal records throughout the country, midwives normally register a lot of pregnant women. But if it comes to delivery, compare those registrants to the number of deliveries, you realize that half of them deliver in the homes more than the hospitals. Because what I know is that most of the families have their own TBAs at home, so they prefer to deliver there.
Apart from the government of Ghana providing basic resources for the reduction of maternal deaths, some institutions have spearheaded projects to even accelerate the process further. One of such is Send Ghana. In view of this, the Improving Maternal Health Services through Participatory Governance was launched.
The Improve project started in 2014. We had done our own political economy analysis in the health sector and realized that Ghana was not heading towards the realization of the MDG goals related to maternal health. Our analysis pointed to the fact that as a country we had not shown greater commitment in investing in interventions that will address maternal morbidity and mortality. And so we saw those gaps and we thought that Improve could provide some solutions and a good model to provide solutions to problems that confront us.
Christian Aid partnered with Send Ghana to implement the Improve project in 30 districts across the 3 northern regions in Ghana. The project was funded by the European Union.
In terms of our relationship with Christian Aid and Send Ghana, we launched a call in 2013 under the Non-State Actors and Local Authorities thematic program. Christian Aid applied with Send Ghana as a co-applicant, where they work in the northern, the upper east and the upper west regions, basically trying to ensure that pregnant women survive maternal mortality.
A UN report on trends in maternal mortality rate from 1990 to 2015 indicated that though maternal health has seen significant progress over the years, the current level of 350 per 100,000 live births leaves much to be desired.
The project employs a very unique approach of working particularly through our governance structures in terms of strengthening them for better maternal health service delivery.
We have been working with Send Ghana for some time now, try to ensure that communities get what they need from government through their assemblies. And so Send Ghana has been engaging our communities, trying to sensitize them on how they can demand their right from the assembly or government.
The project has also been very, very unique in that it has been able to create platforms where citizens have engaged duty bearers.
Dimabi, a community in the Talon district, used to access healthcare from Talon. Pregnant women had to cover a distance of about 10 kilometers before accessing antenatal services.
Send Ghana mara kana kataman ma boite ti yongo tong ban pune yel mo sor shanga dem biete zang chang te bihawo lebago polo bi zang chang te bihawo nyang la bo polo katra to hawo fable wo ba bi to hawo ba kama te yongo yel shanga dem biene te ka ko nyur suma te ka banje te tang ban woni te ka ship te tang ban woni to ka non te virle la ha te pa te papunum zambashi te yelwa ye tolanka bichante zahni kabnon te vero bi bo boate Nika dun chen toloma de vielti te be de vielti te. Tin yaba de viela ama diri nyala yong basa. De nan vielti de don sonan.
De nan walago tolan nan walago ma. Banto nye zang moto. Zang cha. Beti mpala tunji shamma karna. Mpon changwa ma ne zen ma. Aku ya na fansmata be moto kia kapzana. Mpon bapaya.
There was the felt need expressed by the people of Dimari to have a chief's compound within the community. This was discussed with the health authorities of the Tolan District Assembly, and at the end of the day, a decision was taken. Stakeholders, including their representatives at the assembly, their chiefs, they all had inputs into the execution of the project.
So, the partner on pan, never zela shiftima. The Papula was now you cone. One to chandene. To Katamla Suhriate, the yell gisi, let them to poor gisi. To Kawanyeda shell cana. Now no Namiko and carry you.
The District Health Directorate is anxious to get the project commissioned to enable them send personnel there to provide service to the good people of Demabe.
The youth of Kwandema also constructed a footbridge to facilitate easy access to the Wiaga Health Center by women.
The footbridge construction came about when FISTRAD did a community sensitization at Pandema, and this was under the Improve project. During the sensitization, the community members complained about their difficulty in accessing the St. Lucas clinic in Wiaga. As at the time we did the community there, but it was almost getting to their annual festival that they have every year. So they said they were going to table the construction of the footbridge at that festival. And from that festival, they will see how they can raise money to be able to construct the footbridge.
With the bridge, I know for time to come it will help, because the time the bridge wasn't there, it was also a problem. The rivers are two, this bridge and another one in front. So it was giving us a headache.
This construction was done solely by the community members.
The Chips Company in Asigri serves a population of about 10,241 with 13 staff.
We run OPD services, we do maternity services, and among others. So it's more or less like a health center. So staff strength had to increase. And the more the staffs were coming, getting accommodation for them was a challenge.
Through the sensitization workshop organized by Send Ghana, the community saw the need to initiate a project that would provide accommodation for health officials.
It's just a 2-room apartment, which they have tried putting up. But for now, because of the financial constraints, if we would get partners who would hold our hands and help us complete this very structure, it will be of so much help to us. It will help us to serve the people better.
One of the remarkable achievements of Send Ghana's advocacy efforts is igniting the communal spirit within the project communities. Chasi, a farming community within Wa East District, is one such example. After a sensitization meeting in Jairi, a nearby community, the opinion leaders of Chasi were inspired by how the people of Jairi contributed to put up a security post for health personnel through their own efforts.
I came and called our community together. Then we look at our challenges and prioritize those challenges. Then we came out with this mobile clinic. Then how do we build it? Then we decided, then let's tax each other.
So we started the contribution small. Then the community elders also added some monies. Then we have mother-to-mother support groups. They also supported us. And anytime we have community deba with Send Ghana, then they have to give the community elders like cola or water for money for water. We just channel the money to continue with the project.
Before the CHIP compound, addressing issues of maternal health was very tedious. We have seen a lot of improvement in maternal health. Ladies are able to attend the mobile clinic for medical counseling.
At the grassroots level, our partnership was with the Citizens Monitoring Group. These Citizens Monitoring Group are representatives of social interest groups in the district.
The DCMs are very important in terms of advocacy, education, and other activities, because they are known in the district as something like champions.
And these are ordinary, everyday citizens who live in the communities, selected by the communities, some of whom have been peer educated for other projects. Some of them were traditional birth attendants who have now turned into peer educators for the communities.
As a result of the sensitization, the project has successfully increased the understanding and skills of about 50 community champions in behavior change communication through its use of information, education, and communication materials.
In this particular project, we have worked with the Ghana Health Services in terms of undertaking sensitization, in terms of developing education, information, material, building on what they have without necessarily duplicating or creating parallel structures.
The project also has a very interesting and unique approach of assisting district assemblies or our MMDAs to raise revenue.
We realize that IGF is a key thing in governance. In the formula in calculating common fund to a district, IGF has a role. The more IGF you generate in a district, the more common fund you can stand to benefit. Send Ghana had a sensitization in the district, educate them as to the reasons why they need to pay their revenue, that is their taxes and other things in the district. And this particular assignment has boosted our IGF in the district.
We also employed a strategy that ensured that communication was mainstreamed into the implementation of the project. And so at the community level, for example, we relied so much on the community radio stations for sensitization, and that was quite successful in terms of even getting the media practitioners themselves to become more aware about the status of maternal health in their communities and districts.
So, Mr. John Macbeth, would like to find out how far we've come as a region when it comes to tackling issues of maternal health.
And so we employed the media at the national and the district level, and it was very important because it helped us sustain many of the issues in the public domain, and that was quite successful.
To enhance effective reporting by the DCMCs, Send Ghana built their capacities in participatory filming to capture community-level experiences on maternal health.
Myself and my colleagues, we have brought a new face to our organization where we are able to take videos of activities, then we come, edit, and we are able to report that shows the actual picture.
Send Ghana also employed capacity building trainings under the project districts. A total of 60 DCMCs, 20 women and 40 men from the project districts were trained on the improved research tools. The trainings were meant to broaden the understanding of DCMCs and make them familiar with the participatory research instruments developed for data collection.
I was picked as a DCMC member from the community with the reason that when those questions are asked at the assembly and the health center, there may be improvement in the district.
The Improve project was implemented by building the capacities of citizens to engage state actors to bring about the needed change in maternal health.
We are happy that this project is taking place in Dorumu. Mostly when our pregnant women are to deliver, when there are problems, mostly we are only referred to travel to Chao or to go to Wa because this facility is not there. Any little thing with a pregnant woman which can be solved here, but because of the fear, they will refer you to Wa. And sometimes it's not always easy moving from here to Wichao or Wa, because how to get a means from here to Wichao is not always easy.
The children ward in Uchao was awarded to a contractor, and this contractor, the district assembly organized a community deba and informed the community about the project, which the community was happy, and the land or the site for the contract was sold to the contractor, and the community agreed that was the area they want the project to be located. The work is going fine, and the community, we do visit the site, and we are happy that project is moving on well.
The achievement of St. Ghana's Improve project has been remarkable, and every effort should be made for its sustainability.
In terms of sustainability for this project, we have worked in building the capacity of the citizens groups. We've also liaised very well, I must say, with the local government structures, which are the district assemblies. They have been very collaborative, they have been very cooperative in this project, and we are very much assured that this project will not end even with the end of Improve.
We are very pleased with what we have seen in the field so far. We've been to the field a number of times, and we've seen that they're working closely with the district assemblies, with citizens monitoring groups, to ensure that people are able to access maternal health care at the local level, and they've reported accurately in terms of our requirements, both narrative and financial.
We as a country will have to make the necessary effort in the implementation of the SDGs to make sure that no woman in Ghana is lost through the performance of her reproductive role.